So MURANO is actually almost a classic study with all the newer studies that have come, but it was, as most of you know, it was the first study that compared a fixed duration treatment of a targeted agent, venetoclax and rituximab, which was given for 24 months, venetoclax, in the first 6 months with with rituximab, compared to bendamustine rituximab in the relapse setting. And over the years we have many publications and presentations with a lot of deep dive into MRD, into mechanism of resistance, into third lines of treatments after this treatment. And what we expect is that in September, October we have again an update, which probably will be the final update to really learn what's happening to those patients and what happened afterwards. So far, the progression-free survival is very long, it's 53 months. We know that MRD is a very good surrogate endpoint, so patients with undetectable MRD have very, very prolonged progression-free survival without any treatments. And we have also learned that in a majority of patients that you retreat with venetoclax rituximab, you can actually again have a partial response, and also at least in some patients that seem to last for a longer period of time. We also know that if you start with venetoclax rituximab and then give a BTK inhibitor that is working, we just very recently published this 2 weeks ago in Blood. And what we also showed in the Blood paper now is that the regrowth of the clone actually depends on different things. It depends on the treatment. So patients that have had Ven-R had a longer doubling time of the regrowth of the clone than patients with bendamustine rituximab. But also patients with an unmutated IGVH had a more rapid clonal regrowth, and the same was true for patients with a 17p or p53 aberration. And that was kind of maybe not the first, but one of the early data that actually showed that the regrowth after MRD negativity is dictated both by baseline characteristics, mutation status and p53 del 17p, but also by the treatment itself. Venetoclax rituximab giving a prolonged doubling time than a patient with chemoimmunotherapy.